Hey friends, Keith and Christy with you. Today it's Sunday, and we're here at our homes again. Sunday, beautiful weather outside, 72 degrees today. So go outside and enjoy it after you watch this show. Um, we've got two special guests with us today. We've got Mike Moore, who is the Mike, your president, and you're also chief operating officer for Ascension St. Jane Phillips Medical Center.
That's a mouthful.
It's a mouthful, and we're glad you're here, Mike. And also we have Cheryl Clinkenbeard, who's a very good friend of ours, who is, man, you've been busy, girl. I can tell you that. And we're glad you're on the show because you've got a lot of info, and you've helped a lot of people so far. So, real quick, I want to kind of go over the numbers real quick because they have changed since you last saw us on Friday. We're trying to do this about every other day. Sometimes we might do it every day, but for right now, we're doing it every other day, because we want to keep you guys informed. We've got a lot of information. A lot of people are asking us on our Facebook a lot of questions. And so we're trying to bring the experts on these shows, and we've had them all week long so you guys can be updated to what's really going on here in Bartlesville and Washington County, and of course our state too. So on Friday we had 322 positive. Today we have 429. So we have 1,205 negative. Today we have 140 hospitalized around the state, and Friday we had 8 deaths. Today we have 16 deaths, which is 16 too many. So our females are 223 and the males are 206. So as of the state website here, we've got 18 cases in Washington County. So I'm going to go by the state. There's been other media that says other stuff, but we're going to go by what the state says. Our friends over in Osage County, they have 10 now. Our friends in Nowata have 3. And we have about 2,000 people who follow us on Facebook in Tulsa. So our good friends in Tulsa, they have 61 cases and they have 3 deaths. So we're praying for you guys down there in Tulsa. And I know the mayor last night put in the pretty much keep your butts at home order. And so we're praying for you guys down there. So also was really kind of interesting. We had Chuck McCauley on, like I said, Friday. Last Sunday is when we first did our show. On Monday, they fed 762 kids. On Friday, they fed 3,315 kids. And that's incredible. We have a lot of good people, a lot of good leaders right now leading our city. And from the age of 1 to 18, I don't care if you go to Bartlesville or not, you can come and get a breakfast and a lunchbox. And so please tell your friends, tell your neighbors and your family about that, because our kids are our biggest resource. They're our biggest assets, and we want to take care of those kids first. So, okay. Mr. Mike Moore. I've known Mike since the early 90s, and I'm glad that we have you there where you're at, Mike, because I know you've been kind of busy a little bit, and you're probably not fishing very much right now.
I'm not.
You're not. I know you're not. Okay, well, Christy's got a question, maybe more of a statement from Paul Stewart, who is also our councilman here where we live. So you want to kind of say what kind of Paul said about?
Yeah, well, people have been submitting questions. There's some directed towards you. This first one, how many counties or what's the number of people that rely on Jane Phillips as their primary hospital? What would you say, how many, as far as the counties go? It's probably just...
I would say there's probably 4 counties in Oklahoma, maybe 4 counties in Kansas. All total, or for our primary service area, we're about 48,000. If you add in the secondary market, it goes up to about 100,000.
Yeah. Interesting. Now, also, he kind of said hospitals are reporting the number of supplies, open beds, and their total and available ventilators to the state daily, and those numbers are being published. Since Jane Phillips already has those numbers for the state, can they publish their specific numbers?
So we follow some pretty specific CDC guidelines on that, and it's mainly so that we don't get our numbers crossed up and there's consistency in reporting. Mm-hmm. I think that we're really we report those numbers twice a day, so they're actually watching our rates. There's also a national stockpile out there of supplies. And if any hospital in Oklahoma gets low, there's the governor kicks in and they send some supplies to those hospitals. So, and I know that 3 or 4 hospitals have already received those supplies, so that is working. So,
wow. Now, Jane Phillips said you guys you're full, you're supplied.
yes.
Okay, good.
Yes,
good.
we're actually in good shape. And since we have such a large health system, not just in Oklahoma, we can pull resources from other hospitals too. And then, even within our Oklahoma market, if one hospital has more of something and they need to trade something, we've traded things out over the past couple of weeks. Supplies, N95 masks, smalls for larges, things like that. So it's actually worked out quite well to be a part of a larger health system.
Well, and another thing too, real quick, that I had Dr. Earhart on here the other day too, and he said, one of the things that concerns him is that, nobody wants to get out of the house, and so you might not be feeling like you have the flu, you might be having a heart attack, but you don't want to go outside and go to the hospital because you're afraid to get the coronavirus. So have you seen any kind of thing like that going on? I mean, are you guys getting more phone calls on stuff that doesn't relate to COVID-19?
We're getting a ton of phone calls. So that, but I think since we've stopped doing basically all elective cases, we've really shut down the number. But we've also seen a fall off in our ER visits. ERs average, they used to average about 75 to 80. I'd say they're averaging about 50. Now, so I think people are staying home. Maybe people just aren't hurting themselves.
Right. They're staying home and they're not out driving around. Well, and also too, real quick before we go to Cheryl, I do want to give out a couple of websites that I forgot to do earlier, real quick. CDC.gov is always a great website to go to. The one I always look at every day is coronavirus.health.ok.gov, and we'll put all those at the bottom of the screen. Those are really great websites. Also, go to the cityofbartlesville.org. Kelly Williams, who's a rock star down there, she writes a lot of good stuff down there and keeps everybody informed. We also have a 24-hour hotline, which I've been asking you guys to put in your phone. I have it in my phone now. It's 877-215-8336. And obviously, Jane Phillips Medical Center, 918-333-7200. So, okay, Cheryl, hey, thanks for being on our show. Okay, so we have been going, between us three, we've been going like crazy on instant message all week, trying to get our message out to you. You're trying to get your message out to us so we can get them out to everybody that follows us. And I just want to tell you, thank you for all you're doing for the first thing. I mean, seriously, I know you have got your hands full. You told us yesterday that you get 300 calls a day.
Well, I oversee or help 300 residents that live in low-income housing here in Bartlesville, and most of those are elderly. Yeah. So I make sure that they have resources. The managers call me if they need something specific. So I am available for that many people or so.
Well,
but then again, for the whole community, because I want to help.
Oh, I know. And you have. And you were part of that Bartlesville Neighbors Helping Neighbors. You were part of helping that get kind of launched and getting that out there. And that's been a huge resource for Bartlesville and Washington County. So, guys, if you don't have that yet on your Facebook, that's a great one to go to. And we'll put a link up to that, too. You want to ask, we've got some questions for you, Cheryl, when we put this out on Facebook this morning. But one of the things I want to say is that you're right. We got to take care of our seniors, our elderly people. We need to be sure we're calling, we're texting, we're knocking on doors if we have to, if we haven't seen them lately, because I love our seniors, and man, we can't forget about them. Well, we can't also forget about the ones who struggle a little bit with their mental illness and things like that. So we've got a whole lot of things going on here in Bartlesville and Washington County.
And that was one of the questions.
Yeah.
Somebody sent in a question on Facebook. What recommendations would you have, Cheryl, for helping someone to practice good mental health during times like this?
Great question.
I'm not a therapist or a licensed counselor, but I've gone through a lot of trainings talking about mental health and first aid mental health. So to me, the first thing that came to my mind with that question was exercise, eat healthy, and get your rest. Because that's, we got to take care of our bodies so we can take care of our mind. And that's even if it's making a goal every day to do something creative, to find something that makes you feel good on the inside. And you have to be assertive to do that, because it's easy to get depressed or have anxiety, but you have to push yourself. Obviously, if it gets to where you feel like you cannot self-cope and find your coping mechanisms, definitely contact a doctor, or there's several local mental health providers, and we can mention those on your website. But definitely call somebody. A lot of those places are doing the telemed, and they will talk to you over the phone. If they're still accepting new clients, if they need to help you personally, there's numerous hotlines.
Yes.
And we can put those out there. I mean, there's probably 4 that I wrote down of hotlines, crisis hotlines to call if you need to talk to somebody. You can text the word home to a number, and we can post those. But the main thing to me also is to recognize people around you. Know the signs, know the symptoms. If they are withdrawing themselves, if they're sleeping a lot, if they're just not acting themselves, then reach out to them and help them give them encouragement, give them hope.
Yep.
I think it's identifying for each other and becoming a support system for each other. And any illness that we have symptoms, we call a doctor. So a mental illness is the same thing.
Right.
You call a doctor, you ask for help. And there's a lot of resources to help. And right now we're all in this together. So.
We are, and that's what we're doing is we're helping out. We're trying to help out as much as we can by getting all the information out there. And one of the things too, we got to take care of each other, guys. I mean, we just got to take care of each other. We're in this together, so we can't forget about it.
Let me interrupt real quick.
Yeah.
One of the main websites, to give a very specific, and we'll put it on your page again, is the NAMI, which is National Alliance of Mental Illness. And they are an advocacy, statewide, nationwide. And there is a 15-page document that I thought was really, really helpful, that really goes through the questions of, I'm having anxiety, what do I do? I have a loved one that's been, tested positive, what do I do? My kids are driving me crazy, what do I do? So I really recommend to look at that and utilize that website, because it has a lot of basic information and a lot of other websites that can lead you to other resources. So I think, to me, that's probably the first place to go to answer that question as far as the mental health, how to be proactive, and then obviously the local places to contact them.
And we will put all these links on there when we get this out there to you guys, because that's so important. Mike, one of the things that, just as a parent and a citizen of this great city, I want to know is that I think when I was up there at the hospital early last week, and you guys pretty much have it shut down, where I went to the pharmacy to get some medicine for my mother-in-law, and I like what you guys are doing there. Is that how you are right now? So no elective surgeries are going on. Your supplies are great. You got full staff. Everything's good with your staff. So give us an update with Jane Phillips as a hospital.
Well, it wasn't like picking up a prescription as usual. They had to ask you some questions.
Yes.
Was...
Have I had a temperature? Have I done this? And all that stuff. And then had to do hand sanitizer. We need to get in the hand sanitizer business. That's all I know. I mean, you can't find this stuff. My gosh, people. Anyway, Mike, kind of tell everybody out there just the update from the hospital real quick. And do you see yourself maybe doing an update every day?
Yeah, that was a question on Facebook too. What's the chances of having like a daily briefing?
Dr. John Lindblom, he's a dentist, he asked that question, and I think it's a good question. What do you think about having a daily briefing, or just maybe even putting out a writing?
Well, I think if Dr. Lindblom probably checked his email, he would probably see one. Docs are notorious for not ever looking at their emails. Yeah. But if he's not getting it, I believe he's on staff, so I believe he is able to see that. We haven't sent anything out to the public. We've stood up an incident command center in Tulsa, and we have an incident command post here, and we go through all of our issues and problems, and then if we can't resolve them here, we send them to Tulsa, and they have a lot more resources than we do. Staffing, you mentioned staffing. Our staffing kind of fluctuates up and down depending on anybody that's actually been exposed.
Right.
There's some specific things that we have to do to take them out of basically put them at home for up to 14 days. So our screening process has gotten really restricted this past week. And, if you're in here with a pediatric patient, or you're in here having a baby, there's some special or palliative, somebody that's actually dying. There's some ways around those restrictions, but we just want to keep everybody out that doesn't need to be here.
Yep.
And we still want to provide a full service hospital, because there are patients in this hospital that aren't, going through the COVID-19, just regular patients. So, and we just want to provide the best possible care we can without, making it unsafe.
Right.
I guess we'd say.
Well, I know you guys are doing that there for sure. We got about 9 minutes left. I want to try to get through some other stuff real quick before we end this. Cheryl, on I see a lot of things on the Neighbors Helping Neighbors website, and it's a good place to go to. Well, I want to talk about the city church. A lot of churches are stepping up, and we want to say thank you to all the churches, because I know all you guys follow us out there. We want to say thank you for that, because you guys are stepping up. Our church, First Wesleyan, has stepped up.
And I think somebody mentioned last week about the chamber has like a
Yes.
drop off pickup kind of site. First Wesleyan Church has that called the Blessing Box. They've been doing that for about 2 years. And food, clothing, whatever is in that box, it varies. But now City Church, Cheryl, you were saying they're doing something.
Yes, they are collecting food donations this week. They have a bin outside there that you can drop it off. And then next Sunday, April 5th, starting at noon, they're going to do drive-through. And you can go pick it up, and they're going to just have you drive through, and they'll give you the groceries. And they mentioned they want non-perishable items, rice, pasta, canned vegetables, peanut butter and jelly, canned meats, granola bars. It's kind of what Pastor Sam mentioned to me. But yeah, definitely just get them the donations. If you can't get out there, give me a call, something. I will help collect them. And we just need to get them the food, so that way people can go get the food. And I've talked to Pastor Sam. There's a lot of home health care workers and agencies that are going to be able to go get it from their patients, or maybe they have, inbound or homebound elderly. So it's taking care of a really huge need, for our community. So it's kind of a really good resource for food.
Is Mary Martha's still doing pickup?
Yes, Mary Martha's is still continuing. They're doing the same thing. They do the drive-through, to where, you drive through their, I guess their warehouse is how I'm understanding it. But yeah, they're still open. Concerned, you call them instead of going in. You call, and they give you an appointment to get food. One new thing, Agape, they're doing their normal lunches like we've always seen, but they also have what's called a Food for Kids program that's always during the school year, where individuals in the community, actually some of my senior residents did this. They pack snack back boxes for the kids to get on Friday, so they have food for the weekend. And so a church, First Baptist, is going to partner with Agape, so kids can get a lunch for Saturday and Sunday at Agape. Nice. So they're extending that to keep that going. And so that's another opportunity that those kids can get those meals on Saturday and Sunday through that program.
That's so important. I think all the ones who do know the percentage of kids that go home hungry would shock you in Bartlesville. So you might want to look that up and see that number out there, because it's shocking. Real quick. Okay, so Mike, you guys are. I want to say thank you for all you do for our community, because you're an awesome guy, and you haven't changed one bit since the first day I met you, and which I love. You're always calm, cool, and collective, and that's what we need running the hospital. So I don't know what happens when you close your door behind you, but we're glad you're here. We're glad you're running the ship there, because that's important. People see that big building there, and we want to know that thing's up and running and it's prepared. If something bad happens, hey guys, we know the numbers are going to go up. We know they're going to continue to go up. Washington County is going to continue to go up. We just need to continue to do the things that the state and the city has told us to do, and we'll get through this. It's just a matter of time. We'll get through this. So, real quick, Mike, under a minute, what do you want to say out there, real quick, just to the people of Bartlesville and Washington County?
Well, I would say thank you for staying calm. Honoring our visitor policy. I think you guys have done great. Keep your social distance. Keep washing your hands. We'll get through this. We're prepared. We're prepared to go bigger if we need to go bigger. And we want to keep the patients here in Bartlesville. We don't want to be sending anybody to Tulsa.
Right.
So we have the resources to take care of our patients. And I think another website that you would I would say is Tulsa Health Department is a very robust website.
Okay,
I would add that to your list
yes.
as well.
Yes.
And, we have enough tests to test the patients. I've heard that as a rumor. We don't have enough tests. We do have enough tests. So you just have to meet the requirements to be tested.
Okay.
So I just want to make sure that's clear.
So here
in RML,
at Jane Phillips Medical Center, we have enough tests. You just
Yes.
got to meet the requirements of that test. Okay.
And RML has stepped up. Regional Medical Lab out of Tulsa, they are actually doing the test now, and they're turning it around in 24 hours.
Wow.
We're having to wait 3 to 5 days when we had to send them to Oklahoma City. So that's been a big change for us. They thought they were going to come up this weekend on their testing. They were actually come up last Monday to start testing, and they're doing over 200 tests a day. It's been a great pickup for us, especially when you're trying to conserve PPE,
Yes.
the personal protective equipment. They're if we know the status of those patients, we can take them out of quarantine basically and not use up our PPE. So
Right.
It's actually been a big help for us.
Well, we'll link
Appreciate
the,
you guys too.
Well, yeah. Well, you're welcome.
That's awesome.
Well, we appreciate you guys being on. Cheryl, I've got 3 minutes and 16 seconds before this cuts us off. So in 30 seconds, my dear, what do you want to say out there to everybody out there? And
we mentioned elderly, and I wanted to throw out there elder care. They are a great resource. They will connect you with whatever you need. So don't forget about elder care.
Yep.
There's lots of resources. I say get on that Facebook page, and they're out there for people, for transportation, medication, prescriptions. So all of it. To me, we're on the fourth quarter, just like the Bruins always did from their football games. When they always did their hand fourth quarter, it always gave you goosebumps. I feel like, Bartlesville's a team right now.
yes.
We all have our role in the team. Some were more out in the huddle on the field, making the decisions, calling the plays.
Yep.
But, we're all right there. Maybe we're at halftime right now, but we will get there and we'll put our hands up and say fourth quarter, and we're going to win the game.
We are. No, we are. No, you're exactly right, because this is, we've seen the city go through a lot of stuff if you've lived here like we have, and you guys have too. So I'm not worried a bit about this city not prevailing, or the state, and in fact the country too. I've talked about that. You know how passionate I am about that stuff. And so for us, we're going to continue to lift up this city and this county and state in prayer, and all the leaders like you guys, because whenever we can get people like you on there to tell the people out there what's really going on, so they're not believing some of this stuff out there that's on Facebook that's not true, then that's good for everybody. And so, we are so blessed to be able to get this out to everybody. And so for us, continue to pray for us, continue to pray for this state. We appreciate you guys joining us today. I want you to, yes, and we just want to say, check on your friends, check on your neighbors, check on everybody. We're all in this together, and we will get through this together. So
keep a positive attitude.
Yes.
Enjoy the sunshine.
yes, go outside.
We have a lot to be thankful for.
We do. Amen. And so, look, we'll be with you guys in another day or so. Thanks for joining us. Have a great day, and God bless.